Colon cancer, also known as colorectal cancer, is a type of cancer that begins in the colon or rectum, which are parts of the digestive system. In this comprehensive guide, we will explore what colon cancer is, the standard treatment options available, its seriousness compared to other cancers, the prognosis at different stages, promising therapeutics currently in the FDA approval process, the unique challenges it presents, FDA-approved medications for various types of colon cancer, and a list of organizations and resources that provide support for those undergoing colon cancer treatment. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101. Quick tips to help you survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. What is colon cancer? Colon cancer is a malignancy that originates in the colon, large intestine, or rectum. It usually begins as a small growth called a polyp, which can become cancerous over time if not removed. Colon cancer is one of the most common types of cancer worldwide, but it is also highly treatable when detected early through screening. Standard of care treatments for colon cancer depends on several factors, including the cancer's stage, size, location, and the patient's overall health. Common treatment options for colon cancer include colectomy, surgical removal of the tumor and a portion of the colon or rectum, colostomy or ileostomy. In some cases, a colostomy or ileostomy may be necessary to redirect waste out of the body when a portion of the colon or rectum is removed. Adjuvant chemotherapy, administered after surgery to kill any remaining cancer cells. Neoadjuvant chemotherapy, given before surgery to shrink the tumor and make it easier to remove. Radiation therapy, high-energy beams are directed at the tumor to kill or shrink cancer cells. Bevacizumab and cetuximab target specific proteins involved in cancer cell growth and blood vessel formation. Regorafenib, used in advanced colon cancer cases when other treatments are ineffective. Immune checkpoint inhibitors. Drugs like Keytruda are being studied to enhance the immune system's ability to fight colon cancer cells. Seriousness compared to other cancers. Colon cancer is considered a serious cancer due to several factors. Commonality. It is one of the most commonly diagnosed cancers, affecting both men and women. Potential for spread. If not detected early, colon cancer can spread to nearby lymph nodes and distant organs, particularly the liver, making it more challenging to treat. Screening importance. Early detection through screening, such as colonoscopies, significantly improves survival rates. Curability. When diagnosed in the early stages, colon cancer is often curable with surgical removal of the tumor. Prognosis. Prognosis for stage 1, colon cancer stage. 1 colon cancer is localized, meaning it has not spread beyond the innermost lining of the colon or rectum. The prognosis for stage 1 colon cancer is generally excellent. With appropriate treatment, including surgery, the 5-year survival rate for stage 1 colon cancer can exceed 90%. Prognosis for stage 4. Colon cancer stage 4 colon cancer indicates that the cancer has spread to distant organs or tissues. The prognosis for stage 4 colon cancer is less favorable, with a lower 5-year survival rate. On average, the 5-year survival rate for advanced colon cancer may range from 10% to 15%. However, individual outcomes can vary based on factors like treatment response and overall health. Left side and right side in colon cancer. Right-sided colon cancer tumors on the right side of the colon are often associated with a later stage at diagnosis. They tend to grow more silently and can be larger by the time they are detected. Right-sided tumors are also more likely to be poorly differentiated, meaning the cancer cells look more abnormal under the microscope. These factors can contribute to a slightly worse prognosis compared to left-sided colon cancer. Left-sided colon cancer tumors on the left side of the colon are generally associated with earlier detection. They may cause symptoms like abdominal pain, changes in bowel habits, or rectal bleeding, prompting patients to seek medical attention sooner. Left-sided tumors are often better differentiated, and they tend to be diagnosed at earlier stages, which can lead to a more favorable prognosis. Why is colon cancer tricky? Colon cancer presents unique challenges. Silent progression. In its early stages, colon cancer often progresses silently without noticeable symptoms. Limited early detection. Routine screening is crucial for early detection, but not all individuals undergo regular colonoscopies. Metastatic potential. Colon cancer can metastasize to distant organs, particularly the liver and lungs, making it challenging to treat at advanced stages. Complex surgery. Surgical removal of the tumor and portions of the colon or rectum can be complex, and recovery may be challenging. Bacterial infection and colon cancer. There is a link between certain bacterial infections and colon cancer, particularly in the context of chronic inflammation. Chronic inflammation in the colon can lead to the development of colorectal cancer over time. Two notable examples of bacterial infections associated with colon cancer are Helicobacter pylori, H. pylori. This bacterium is primarily associated with stomach, gastric cancer. Chronic H. pylori infection can lead to stomach inflammation, gastritis, and may increase the risk of developing gastric cancer. While it's not a direct link to colon cancer, chronic infections like H. pylori can trigger a systemic inflammatory response that might have downstream effects on other organs. Inflammatory bowel disease, IBD, conditions like ulcerative colitis and Crohn's disease are characterized by chronic inflammation of the gastrointestinal tract, including the colon. Individuals with IBD have an increased risk of developing colorectal cancer due to the long-term inflammation. Regular monitoring and early intervention are recommended for IBD patients to detect and manage any cancerous changes promptly. FDA-approved medications for colon cancer. Several FDA-approved medications are used to treat colon cancer, including fluorouracil, 5-FU, a chemotherapy drug used to kill cancer cells, capecitabine, an oral chemotherapy medication that is converted to 5-FU in the body, oxaliplatin, a chemotherapy drug commonly used in combination with other agents for colon cancer, bevacizumab, a targeted therapy that inhibits blood vessel formation in tumors. Cetuximab and panitumumab target specific proteins involved in cancer cell growth. Regorafenib, used in advanced colon cancer cases when other treatments are ineffective. Two integrative treatments that may be effective for colon cancer include dietary modifications, particularly abstaining from red meat, and certain strains of probiotics. These are discussed in more detail in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. Organizations and resources for colon cancer treatment. For individuals and families affected by colon cancer, several organizations and resources offer support and information. Colorectal Cancer Alliance provides resources, support, and advocacy for colon cancer patients and caregivers. American Cancer Society, ACS, offers information on colon cancer, treatment options, and support services. Fight Colorectal Cancer, advocacy and support organization dedicated to colon and rectal cancer awareness and research. For more information, please see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.